Therefore, again, making a call and physically meeting them whenever possible is a priority for us, so that we can stop a child being institutionalized because of lack of food and counseling. Also, parents in villages say that they are able to sustain on their local grains and local products like last year for now. But if the lockdown extends, lives will be difficult. One of the reunified children's parents in Rameshap district shared with our senior reintegration officer Mangal brother that the local food crops from their farm are able to sustain their family. Most of the families are daily wage earners, and we know what it means when our children wait for the food in their plates and you have no money to buy them rations. Our team started delivering emergency support urgently to keep providing food. We are also making cash support to families through online bank transfers. A grandmother taking care of two reunified sisters shares that she is grateful to see how their family is supported during such harsh times of their lives. One phone call makes her day, and she says that someone cares. Our team have become an extended family for the children. Some of the parents and children are suffering from seasonal flu. This month, our social workers are giving as much attention as possible to encourage them for quicker recovery. Sujil and Sonu's mother said that they have now almost recovered and thanked our reintegration officer Sagar brother for his constant care through weekly calls. One phone call or message during such pandemic times makes a difference. Believe me, reintegration officer Sajid brother was in bed rest due to COVID-19 infection past 2 weeks. Sumesh and Reunified surprised by him calling himself to let him know that he's doing fine these days and he's attending virtual classes with his friend. He also requested Sajitai to take care as cases are increasing in Kathmandu every day. And one phone calls made our reintegration Sajid brothers stay. One phone call makes a difference. This is the relation and trust we have earned from our young care experience, and this is what keeps us going and encourage us to do more. What are we doing? Apart from all these, we also have a network of care experience, young adults, which was formed in November 18. The main motive of the group is to engage and form a network so that we can discuss about different issues regarding child rights advocacy. We have been meeting once a month in the previous month, but as we have lockdown now, we all have managed to meet once a week, share our ideas, discuss on social issues, and most importantly, to know each other, our mental health state. Yeah, thank you.
Wow. Thanks very much, Diksha. There's some really great takeouts from there. I mean, I know our team works very hard, and I know that the best thing about our reintegration team is that they respond. When the phone call comes, they respond as quickly as they can. One thing that you've said out loud there is that relying on each other and the upkeep of our connections for our own mental health has been vital during this time. We can only imagine how difficult it's been. And having to keep working in such kind of scary situations it's commendable, truly commendable. You have each one of our backing for you to all keep doing what you're doing and to stay safe. Thanks for sharing the stories tonight, Diksha. I wish you well conducting the Care Leavers group. I know that those mighty young voices will help shape the way things progress in Nepal, particularly about our issue of orphanage tourism and child trafficking as we move forward and out of COVID times into the future. So thanks for the vital work that you yourself are doing. And again, if there's any support that you need directly, please come and ask directly and we'll support you as best we can. Thanks again for joining us, Diksha. I appreciate your help. We don't have Patrick online, do we, Emmeline? No, Patrick hasn't been able to get online. There's a message he has not responded to yet. So we might just move straight over to Diptesh, who's, are you still in Delhi, Diptesh?
Currently in Maharashtra, Pune.
Okay, great. So as all of you know, Diptesh
next week is Delhi.
Okay, great. Dippy's the director of LAF in India, and our partner on the ground there, delivering some incredible works pre-COVID. And now he has his work cut out for him in these COVID times, supporting the very, very, very many hands that are shooting up, needing support. So I'll throw over to you, Dip, to give us an update of how you've been going, particularly with the response that we've been able to help you with financially, how it's going, where the needs lie moving forward, and how best we can help as we progress. Please, over to you.
Yeah. At first, please let me know if I'm clearly audible.
Yes, we can hear you very well. Thanks, Dip.
Okay. I'm in India actually, and we use fan here. So let me switch off the fans for a better audio call from both the sides.
Okay, sure.
Okay. So to start with, I would like to give first some of the overview so that everyone can understand the actual ground situation, and almost everyone do have an idea how Islam looks like, how the life of Islam looks like. And if I will give overview, then everyone can understand and imagine like the situation, how when we deal with some couple of thousands of people, it need like some random and some special strategies to implement for better relief of people. So at first, I would like to let you all know about what is the actual problem right now, other than what media is saying. The actual problem is in the Islam, the population. The population is so much. We ourselves in LAF are connected over 2,000 families. They're in Kalyanpuri itself from one community. And luckily, only in 2 laneways, there are small alleyways in the slum, and only in 2 alleyways were affected. Rest of the areas are not yet containment zone. So there is no such problem of infection. So we are, at the moment, we are able to control the sanitization and awareness in these 2 alleyways, and door-to-door checking of each and every symptomatic person there. So what we are doing, we are basically trying to aware people about the hygiene practices, because people in Islam who are so marginalized and rag pickers, they obviously stay far away from hygiene practices from their day-to-day life. So we understood ki, okay, so to stop further prevention of this disease, we need to educate people, and we need constant sanitization, and also we need to create like a little bit of threat so that they can take it seriously. Because earlier we were noticing not everyone was serious about it. They thought it is a rich man's disease. Only people who live in air condition, they will get like COVID infection. So all these kind of myth and rumor is spread in slums like anything. I mean, I still remember it took a long time for us to introduce, like couple of sanitization stuffs there. So educating everyone about mask, sanitizer, like we keep on distributing mask and sanitizer as a regular practice. And we have like 6 volunteers on board, which is a good news. Earlier we had only 2 people. Now we have like 6 volunteers from Islam itself. We have trained them like a couple of years back. They were our ex-student of Brighter Future Study Center. So now 6 people volunteering, and our old teacher who is a project in charge, and 1 more guy. Like, so we are team of 8 who are dealing with around 1,200 people, like in general, like from Kalyanpuri Islam. So in those 1,200 people, we are focusing towards around 70 families who live in 2 alleyways, and the problems or infections are coming basically from these families. So for 70, 80 people around, we have made some strategies of how to deal with them. So our strategies are to rent or hire houses in the same area, so that if they need any isolation, we can isolate them in their nearby houses, because they are scared of going to hospital. Because news are not very positive from hospital. Couple of people are dying, and they feel like they have a myth like if they will go to hospital, they may die. So we have to create alternatives to hospital in houses. I have shared like one photo in Joe's fundraiser page about like a like we can like it's not ideal to share like many photos because it is it's horrific. I can share like in person, but I don't think it's a social media stuff. So we avoid like capturing like footage from slum. Only like filtered photos are coming out. But this renting house strategy is really working nice. People are having confidence and they're feeling like, okay, they only need to isolate themselves and be on some, like some precautionary medicines, and like just a doctor and a healthcare visit is enough for them to save. And that's how their D-dimer is basically um, something what checks their infection level. And in this COVID cases, it increases when you are panicking, when you are scared, it increases. So below 9 point, the dimer is good. So we have a close observation of all these 80 families like who are living in this area. We do have machine, we do have like regular healthcare worker who are checking their D-dimers, whosoever has infection or symptomatic. So we are checking there. It is really helpful. From past 10 days almost, we are renting house now, and they know even if they are not infected, but they know if they will get infected, they don't need to go to hospital. They need to go to one of these houses what we are renting. So hospital we have kept in a strategy, we have kept for very critical patient who need observation, who need intensive care unit, who need like proper team of doctors all the time. So in the area itself, we have like one hospital where our 17 now, like one more released yesterday. So 17 people are like admitted, and rest of the people who got discharged from hospital, we are again isolating them in house for 1 more week to just take care of their D-dimer and CPR, like their level of because the chances of blood clotting and heart is so much high in COVID. Even after releasing from COVID, we are scared that if we send them to their houses and they will live their normal life, it won't be it is not advisable. They need like really critical care, they need good food, they need proper monitoring. So for that purpose, these houses are very useful. So as far as strategy is concerned, our strategy is to look for more houses. At the moment, we have capacity to accommodate 12 people, but we are looking for accommodating at least 50 people. That means like 5 to 6 more houses. Houses we are renting on a very cheap price, so that's not a problem. Also, like community is helping. I mean, people are ready to shift in other houses, in neighbor houses, and they're saying, okay, use our house, it's not a problem. So we are getting lots of support from ground. Everyone is helping each other. It is not like we have to convince them or we need like they're charging high rent or something. It's just maintenance is our cost. So that's one good thing. Our next mission is to secure house for 50 people for isolation. And if the infection, our future strategy is if infection crosses 100, then we need to set up tents, the kind of tent what FMN has sent to Nepal during their earthquake. So I do have like I have experience in buying those tents in India. So I can like we have funds ready. We can immediately purchase it and set up it in Islam area, like Islam where everyone has visited, like that area where Metropolitans was there. At the moment, like 2 people from that area who lives in like literally on roadside, those people are living in one of the houses, but they don't feel very comfortable in house. We also need to take care of their comfort because they are not practiced of living in a 4-wall structure where proper toilet and facilities are there. They are very uncomfortable, and we don't have very local volunteers at the moment who can train them or make them comfortable. They just get panic and they want to run away. So we are trying to understand on their psychology, because casualness is part of people behavior, there like casually like you might have hearing the news, in media, how in India only 10% people are taking masks seriously. The way they are wearing is accurate, or double mask. I mean, they feel suffocated. So that's one thing what is constantly is a constant problem to us. We need more and more awareness. We are still learning every day how to do it. Soon, like in this week, we are going to start like announcement on loudspeaker about how to use and why to use these things. And I'm personally recording like a couple of statement of mine, because people recognize my voice and my face there. So maybe they'll take it seriously. Next week, my visit in Delhi is very promising. My board, like in LAF, is also like thinking it is required. So I'm definitely making my move there for a week. And regarding other things, I would like to just give you all a quick shot of I'll just read what I have drafted on my paper. So basically, to understand this whole thing, problem and solution, if I share, it will be much easier. So the clear problem is pre-diseased people who are already fragile, who are suffering from diabetes or have some heart diseases. They are on higher risk, because now black fungus is another thing which has just come up. So it's not just COVID, it's like other thing which is also upcoming, which is on the way to come. So now we are also trying to identify the people who are very fragile, who already have some history of either diabetic or like some respiratory issues. For example, with one of our board members, Sumit, like who has been in hospital, like critically ill. So he has a respiratory issues like from past. So so these kind of people are fragile. We understood from his case, okay, so the people who are already like who have a history of disease, they are like more fragile, and we need to protect them first. Because if one person is infected, like one person is not safe, no one is safe in the area, because it is densely populated. I mean, I guess I don't have a data, but like I think every square inch there is like somebody lives in every square inch there, or every square foot, like somebody is there. So technically it is very difficult to maintain social distancing. So all what we can do, or what we are trying to do, is to do constant sanitization of alleyways. Soon we are looking forward for option how we can sanitize people houses. Maybe we can take people out from their house, and in 10 minutes we can sanitize their whole house. Something like this. We are thinking about it, but we don't want to create any immediate panic or pressure, like, oh wow, like why we are doing this. So we are launching everything step by step, swiftly. We are also learning it, how to get the gadgets, the right gadget which is good for sanitization. I'm also doing my YouTube research on finding machines like that, because that is the requirement. If there is any suggestion from anybody, or if you guys know anything like that which is good to sanitize, it will be helpful. That will be like our part of our future strategy. Now coming back where I have started, so we basically, when we were diagnosing like our higher risk, so our higher risk were people who have a history of some diseases to avoid this black fungus. At the moment, luckily, touch wood, we have no black fungus case, but it is so high in Delhi. After getting steroids, like people are also facing like suffering from black fungus. And I think black fungus is not curable. Like we don't see any success rate here practically. Second issue is like missing hygiene practice behavior in slum dwellers. That is one of the major problem I find. For that, we are doing regular sanitization. Need to go on another step of sanitizing people's houses. At the moment, I don't know how people will take, whether it will be people's acceptance or not. If we seek their permission to sanitize their house, I don't know how they're going to take this, respond on this. Third is like the mothers who are basically pregnant at the moment. They are also on high risk, because we have heard of that third wave may also come. And in Delhi, in a couple of other states, including Rajasthan, Gujarat, like we have heard third wave or a some sign of third wave has come, which is risk for children below 18. So that is coming around like 1,000 cases in Rajasthan, which is not far from Delhi. It's our borders are connected. So it is already there, almost 1,000 cases. So we need to be prepared for that as well in this pandemic. And I don't know, like the situation of vaccine, when it will be coming to India and when it will be available for the kids. But if it will, LAF will be the first organization, I'm assuring, who will jump into this campaign, and we will vaccinate like every possible children there, because that's our first prime focus. But at the moment, what I find a strong need is every child should be nourished. They have a history of not eating or not eating proper food is there. We have like so many children. I think like we need like we really need to take food seriously, especially nourishing meal, maybe by creating a community kitchen in the area where like we can hire, like I have a experience in running restaurant here, so maybe I can lead this, and we may cook for say 500 people for 500 children or something, and ensuring their nourishing meal and their mothers like three meals a day. That is our next strategy, because if they are not nourished, they cannot handle medicine, because medicine in this are very strong, and steroids are very common in COVID infection. Also, to balance their CPR and other level, it's very important to eat like good food, especially lentil and other recommended stuff, and couple of Ayurvedic health drinks, etc. So I don't think teaching everyone to cook these things in their houses is viable. I mean, it's better to create a community kitchen, take a space and cook regularly. Should be our next step. As far as like the like the budget is concerned, we are trying to be very specific about on spending any single money, though it is emergency time, but still we are trying to use all our intellect and all our patience to spend any money, because in this time the biggest threat is brokers. I mean, the mediocre who are who are black marketing anything. So even from buying medicine to buying injections, and to even grab a space in hospital, everywhere at every step there is some broker. So we are trying to minimize that, and we are securing we are trying to purchase our own asset, what has a value, and we may further sell it after COVID. So we are trying to buy those stuff. For example, oxygen cylinder. Now we have 100 kg capacity of our own oxygen, which can be circulated among people. At the moment, we have 20, and we have ample oxygen, I can say. Oxygen budget, like it's hard to say ki how much monthly like we are spending at the moment, because it is going very random. But still, if I closely monitor, it is around $250 to $300 Australian is our weekly expenditure. What I can see, probably it will reduce, because oxygen availability is growing with every passing day. In Delhi, like government is setting up new oxygen plant every second, third week. So availability of oxygen is coming. So at the moment, our expenses around $250, I can say, Australian. All what I'm giving the figure is in Australian dollars, so everyone can understand. So it's around $1,000 a month, if I assume, like at the moment. Other than that, for medicine purchase, we do have a sponsor, which is almost sponsoring like 70% of medical purchase. But like some other hygiene stuffs, we don't have any sponsor, so we are dependent on this budget, what is currently being raised in Joanne's fundraiser. That is also diverting toward buying hygiene stuffs. For example, diapers are very important and very expensive here. Adult diapers, I mean, people who are admitted in hospital or who cannot access public toilet. In slums, our biggest problem is public toilet. They have to walk. Hospital are like, toilets are not in houses. They have to walk. And infected people, better they should not walk. So we have to organize, arrange like those stuff where they can, where we can maintain the hygiene practice, and they do not need to be exposed for accessing any toilet. Also for these, our major 20% of our budget is going to find and facilitate the solution for hygiene practices. Other than that, at the moment, I would say situation is in control. At the moment, I have a strong feeling that everything is controlled. I can't see anyone dying. And like, it's such a good support, like this money, whatever is being raised and sent by Forget Me Not and Joanne's Crisis Fund, Razor Relief. I mean, these are helping a lot, and this has given us a massive support and confidence. I confess, like before this, even I was losing my hope, and I was also watching TV. I was wondering, like, okay, so news is going here, stats is going here. Now this many people died, this many people are infected, and crematorium and all these things. It was like my threat, and we were looking for services in crematorium. In fact, we have organized like cremation. So far, 53 people died, like from slum, from both our projects. So I thought like our next step is to create a crematorium, or maybe doing like full-time job like in crematorium or something. But now the confidence is, we know we can save people. It's not a big deal. It's just a virus. We should not take it like a pandemic. It's more media and more of casual behavior of people. So more awareness is needed. And it will be, and we will win. I'm pretty sure the way we are working and the team is working on ground is giving result every day. I spend my time on mobile phone most of the time, and that's how I'm getting reports and I'm connected to the people. My phone number, I use 2 mobile phones, and both are like spread in the slum community. So my number as a counselor, and like 2 doctors who were friends of LAF, and a team of healthcare workers. Around 7 to 8 mobile numbers are circulated in Islam. Everybody has these numbers. They can reach us 24/7, because people need mental support as well. When they are panicking, they feel like, okay, where to approach next? So I get a call every now and then. So these strategies are a big help, and I can see a good ray of hope. And but I think it is time. It's probably maybe for 3 more months. Like we need to have, like, we need to be prepared for at least 1 more quarter. At the moment, I cannot give any ballpark figure for how much money we will be probably needing in next 3 months. But based on our expenditure, which has happened so far, I guess $5,000 or $6,000 a month is what we will end up at spending. It may go down, it may go up to 50%, or it may go up. Can't say anything. It all depends on how much support we are getting from Delhi government. We are trying our level best to get anything what they have in their scheme.
Yes, of course.
It's more of media, like, and media says like, okay, they are distributing food, but that's not, unfortunately, that's not the fact. You know, like, you have to apply for a food and you will get a food after 2 months or something. But still, we are hopeful. We have our people, like, as Andrea, you know, like Mohit is very good. Like, he was infected with COVID. He was our ex-volunteer, like a team member from a long time. He's holding a good position in government. So he's a big help. So let's see, like, he's fine now. He's out of COVID now. And I'm hoping like a big bundle of groceries from government, at least for Rajghat area. At the moment, what we are talking about is Kalyanpuri, because they are most fragile and they live in very dense situation. While in Rajghat area, like, there is lots of space, and you know, like, people can set up their bed anywhere because it is situated on a river bank. So lots of space and greenery is there.
Yeah.
Less cases are there.
Fantastic.
While, yeah, so this is all about.
Fantastic update, Dip. I'm telling you, it's you're doing an incredible job on such a limited amount of funds and limited amount of volunteers to be able to deliver this work. We're right behind you, supporting you every step of the way in any way that we can. It also brings me great joy to hear that you yourself feel more hopeful and that you can feel a light at the end of the tunnel. That brings me joy. Yeah, so thank you so much. We'll be doing our best to continue to support you in any way that we can. You really are a legend, really. A legend.
I would definitely like to express my sincere thanks to Joanne. I mean, like the way she just come up, I mean, it has just reignited the fire, and you know, like all what we are talking and the way we are updating on Facebook, it's giving like lots of confidence. And I'm also like every day feeling like, okay, so what is next update? Like, and I'm thinking about positive, like about not COVID positive, thinking positively about updating and reporting. So that's very nice. Thank you, Joe.
Yes, thank you, Joe. And speaking of Joe, Joe, you are the brainchild behind Run for Their Life campaign. As Dipkesh said, you thought, what can I do? And thought this is a brilliant idea to harness the power of the people and get everyone behind you to try and run, jump, swim, crawl, whatever you can do for the month of May. And you've done an incredible job rallying your friends and supporters who've been long-term supporters of Forget Me Not over time. Some of the faces and names are familiar, but you've done an incredible job. Do you want to give a quick update, Joe, about where you're up to with that?
Yeah, well, I suppose, I mean, it was literally, around the end of April, and obviously there was all this, news coming out about India and the lack of oxygen. And I don't know, I just woke up one morning and just thought of that name, Run for Their Life, just because I'd gone for a run and I was just like, oh my God, like just being able to breathe, taken for granted, that simple thing of just being able to breathe oxygen. And I'm not a big one for social media generally, but I just started researching different fundraising platforms to supply oxygen, literally for that reason. And the Facebook fundraising platform came up, and these days not everybody's really engaging with Facebook. Instagram does seem to be, gaining popularity, but it was just so easy to do it through Facebook. I think that was the thing. So, yeah. And look, the key thing was just empowering others. So rather than just taking it all on, one person can only do so much. It was about how can we kind of get this domino effect and empower others to run as well. And just trying to really use social media for good and turn that around and do something positive with it. So the idea, and then, I started talking to Dippy about how much would it actually cost to save one life, So just trying to break it down into tangible goals for people in terms of raising a certain amount that was doable and really would achieve something specific. And I just thought, wow, that's pretty powerful. If we could just save a life, if you did that in your life, that would be a pretty cool thing. So we ended up with this figure of $500 based on a certain, amount of oxygen for the period of time that someone would need it for. And it came to around 480 something. So I just rounded it up to 500 Aussie. And then, it was just really about putting it out there, just getting some communication tools. And it just seemed to come together as a concept. It just made sense, and I think that's why it's worked to a certain extent. I mean, my original goal was to get 50 runners, each raising $500, which would be 25 grand. The reality is I actually thought it would be easier to get runners on board, but that's been a bit of a struggle getting people's commitment. I think, we've got 13 runners. We've got a week to go until the end of May. One's still kind of sitting on the fence, and that's the 14th, hasn't really committed yet. But, so it's been interesting. I've got one person who's raised $100 and somebody else who's raised nearly 2,000. I just kept upping my target, and I'm now at, I think $5,774. So I'm amazed, because it's just, been this progressive kind of flow of money coming in. And I suppose, yeah, just trying to use quotes and a fair bit of visual material and branding it, and just trying to really, every time somebody donated, I kind of invited them to be a friend on Facebook. And yeah, interestingly though, I haven't really had, and I don't know, this is where we need to do a bit of a stock take, I suppose, of the Give Now platform, but out of India, I don't think there's been that many donations, but obviously, you know, that there's issues there and people are really struggling anyway. But particularly because this campaign was in honor of, or in memory of my friend who, you know, I don't know, you know, Dippy knew Akash very well, and his passing was really also the instigator. It was the news reports as well as Akash, he was 44, fit and healthy. And I just thought, oh my God, if he can go, like, and he has money, he was in a good hospital. And I just thought, people are so vulnerable. Here's somebody who's getting excellent care, who's fit and healthy, and he still hasn't made it, you know? So I thought, this is serious, and it's going to get pretty bad. So yeah, I mean, at the moment, we've raised $15,774, which means with a week to go, we've got $9,226 to reach the target. And I don't know, I'm pretty keen to hit the goal. You know, we lost momentum.
You never know what can happen.
You never know. And we lost, you know, like anything, it loses momentum. But look, I just think if we can get 18 more runners running, yeah, I don't know, you'd have to run 7 or 8K a day for the rest of the month to hit that target. So it'd be a pretty big commitment. But if there's 18 to 20 people out there who want to step up, I think getting runners is what's going to get us over the line. But anyway, we've raised a lot.
It comes in waves, and
yeah, it does.
This week, it's vital now that even Forget Me Not jumps behind some of those individual things and starts sharing their things directly on our platform. And the donations have dripped in again over the weekend. That total has jumped again. So it's commendable what you've been able to pull together. And like you said, even if we can save one life, it's been fantastic. And we'll continue to work the Run for the Life campaign as best we can. We've also got, like I said earlier in the piece, a car rally that we're looking to get cars behind to jump on board. And that's also going to donate a chunk of money to be usable for our overseas COVID response. We've got the Money Distillery behind us with folklore gin sales for the month. We've also had a plea and a social post in Harvey Bay telling the true story of what's happening in India and Nepal through Michelle, who's shared some of that information as well. So, you know, we're pushing everything we can. We've also got an emergency feast trying to bubble on the Northern Rivers back via Matt in India. We're going to run one of those again to try and just to, while the momentum's hot, to try and pull some of those funds together so we've got some momentum. But as you can see, you know, the fundraising environment in Australia still, as a result of COVID ongoing, is not as vibrant as it could be. But once again, those that have a little to give are giving, and it's the little bits that are helping. So thanks for all of your efforts pulling that together. I really appreciate it. It's been incredible. So that's it for Rise for tonight, people. We have to try and stick to our time zone. I'll be in touch with you again tomorrow, I suppose, Joe and Diptesh. And also, Diksha, thanks for sharing your news with us tonight. Thanks for all the team that's joined us tonight, and for everybody else who's popped in to hear what's happening with Forget Me Not. We're very, very appreciative with everything that you've offered to Forget Me Not, being the custodian of the funds that you've offered, relying on us and trusting on us to be able to deliver on the ground and helping people directly. It really means the world when you trust us, and we'll do our very, very best. As you can see, we have an incredible team across the countries where we work, and my gratitude goes to those people working so hard. Please, everybody, stay safe. And from Em and I here at downtown Brisbane, it's good night, and we'll see you again. We have a Wellbeing Wednesday for our team next Wednesday, the 2nd of June. So hope to see some of your faces again then. Till then, good night. Please stay safe.